Good morning. Good morning. I know it is early. Welcome to the Inspiration Zone. Listen, you know it had to be something good to get me up this early. We are here earlier than our 10 at 10. Thank you so much for joining us. We have a treat for you today. Um, a treat is the only thing that I can categorize it as this fabulous Friday. We are definitely in for a treat. Today we have none other than Mr. Eugene Poole. I'm going to let him tell you about him, but I'm going to tell you something right now. I need you to go tag, invite, and share. It's open enrollment time, guys, when it comes down to your health insurance and your health coverage. And the gentleman that is joining us this morning has 40 plus years in the health industry, in the health insurance industry. But oh, how amazing! In today's time, your health is your wealth. And if you stay tuned, you'll indeed understand exactly what that means. I believe, when you don't know, you go to the professionals. Mr. Eugene Poole, welcome to OPNS 97.1. Good morning.
Good morning. Thank you, Shanta.
Yes, you are welcome. Thank you for being here. Is it early enough for you this morning?
Just fine.
See, I'm not the early bird. It's like, okay, I need it at least to 9:45. Amen. Amen.
Amen.
So what we're gonna do, thank you guys that are tuned in to OPNS 97.1 this morning. Thank you for grooving with us inside the Inspiration Zone. Mr. Poole is gonna join us every Friday. Yeah, you heard me. Every Friday at 8:45 to be able to educate us to our best place. Y'all know my motto here. We grow best together. Here we grow. And the whole purpose of everything that it is that God has blessed me to do is to help you grow to your best place. So, Mr. Eugene Poole, you are the proud owner of Aligned Benefits Groups Incorporated, correct?
Correct.
Okay, and that's hailing out of where?
We're out of the DMV. We're based out of Maryland,
Okay,
but we also operate in Virginia and in Maryland, Virginia, and DC primarily.
okay,
But
okay.
but I also maintain a personal license in Georgia, North Carolina, South Carolina, and Delaware, West Virginia, New Jersey, New York, and Ohio.
Okay, okay. That's quite a bit, but then that definitely means you know your business. So I have a question for you. First and foremost, I want you to introduce to our OPNS 97.1 family who Mr. Eugene Poole is, because there's always a reason why we do what it is that we do. I know
Right,
for
right,
me, I have a heart after God's people. And if I can take a little bit what he's allowed me to learn or what he's put on the inside of me and spread with the world, I feel like I'm, I guess you could say serving my purpose. So
right.
tell us about Mr. Eugene Poole and why it is that you are so committed to educating us all across the board, Black, white, Hispanic, Latino, any people. Tell
Right,
me why you are so committed to help
right,
us to our best place.
right. Excellent question. Thank you for the question. So
Mhm.
anyway, the reason why I got committed to this business is because health insurance is very complicated. And what I wanted to do was to use my ability to learn, to study the subject matter, to figure out what was going on. Now, here's a startling statistic. According to a recent Transamerica studies, approximately 60% of all bankruptcies in our country is due to medical bills.
Okay.
And 50% of the people that lose their homes also lose it because of medical bills. So I thought about that. It was just startling to me because I looked at myself and I said to myself, why in the richest country in the world should this happen? And the other thing, I'm a former chairman of the board of a nonprofit organization, and we work with the homeless. And I sat and I talked with a number of homeless people. And let me tell you what happened. There was one gentleman who had a nice house in the suburbs. He was a taxi cab driver. And what happened was he had a heart attack. And the first heart attack, the insurance company paid for it. No problem. It was over $100,000 in bills. So they paid for it. But then he had a relapse and had a second heart attack. And when he had the second heart attack, the insurance carrier did not pay. and he ended up losing his home. Now, he was married with a wife and 4 kids living in the suburbs. So what happened once he lost his home, the children were out in the streets, and protective agencies came and said, "This is child abuse. These kids can't live in the streets." So they took the 4 children away, and the wife couldn't take it, and they ended the divorce. And then that's how he became homeless. And I'm thinking to myself, why should something like this happen to anybody? You know,
Right.
why is it? This just not fair? And so I looked at the a lot of the statutes in the insurance industry. So by way of background, my background is I used to work for a major health insurance company. I had a lot of insider training about electronic claims, health, how does it work, how do they fund it. I had a background in taxation. I owned a tax company for 30 years. I did taxes for 30 years. And I put my tax background with my insurance background together because when the Affordable Care Act came out, people to this day are confused. They don't know what to believe. And so
Right.
I decided to take advantage of my ability to study tax code, my ability to understand the insurance statutes. And I saw that most of the stuff that happens to people can be avoided for the most
So,
part.
so is it safe to say, and I want to welcome to the room K Rev. Hey, we're not
Hey,
welcoming
Rev.
to the night, but you're definitely here this morning. Thank you for joining us, Carrie. So I basically listening at your resume, you position yourself. One of my favorite scriptures is to study to show thyself approved, right?
Yes,
And it sounds
absolutely.
like you've done just that to be able to help people across the board. Now,
Yes,
and listening to the passion that drove you, it's always those things that pull at the heart, right? Now,
yes,
so if I'm hearing this story correct, um, you had a gentleman who just had a health issue,
right,
and the coverage that he had where he thought he was A-OK
right,
covered him the first go round.
right.
Oh, but there was a second go round.
That's right.
And doing the second go round, his insurance would not cover him. That in itself is enough to say, okay, wait a minute. So you're telling me I'm paying all of this money to be covered. And just
Right.
because this happened to me a second time, now the domino effect is I lose my home, my
Yes,
family,
yes,
so yeah, that in itself is indeed a pulling at the heart, you know what I'm saying, to birth
yes,
that passion.
absolutely.
So let me ask you something, and Carrie, please jump in whenever. Let me ask you something. It's open enrollment time.
Yes,
And I remember when this first started, the first year of President Obama's term.
right.
I
Affordable Care
remember
Act.
because I was fighting to help people save their homes, and I had to learn a lot about the open enrollment. Could you please share some enlightenment? Because I have quite a few people that I'm connected with. And here's the thing, from corporate level down to just the housewife that
Right,
have a whole bunch of questions
right.
as to why, what it is with this open enrollment. Why does it seem like my insurance costs too much? I know this person and they make this money and they pay less than us. Can you share some clarity on this? Because I
Yes,
know that if we have the clarity, people will start sitting around defeating themselves and not getting insurance.
that's correct. That's correct. So let me put in my caveat. The
Okay.
caveat is that what we're about to say and share with you guys, we're not giving out accounting, tax, or legal advice. I have to
Right.
say that in all honesty, because you want to make certain that you consult with those professionals in that arena. But what I'm sharing with you are real world examples and how things generally work so that you get a concept on the ideas of what you can do. And you can also confirm it with your professionals as well what's being done in the industry because I am in the field on the front line. I am the person who gets people enrolled in these programs. I'm also
Okay.
the person that sells to the companies. I have about 80 companies right now that I support, and I
Okay.
have about 100 individuals aside from that. So I'm the guy that actually gets people enrolled. Now, let me say this before I tell you about the Affordable Care Act. I want to give you a general statement and show you what's happened in our country because I
Okay.
think you need a little history behind this.
Okay.
So they say that necessity is always the mother of invention.
Okay.
Now, so what happened in 1965, Lyndon Baines Johnson passed Titles 18 and 19 of the Social Security Act that established two programs. One was Medicaid, and the other one was Medicare. So before I get you into the Affordable Care Act, let me explain to you what those programs were, and then I'm going to bring you up to date with the Affordable Care Act as to what happened. Medicaid was established because of what we have known as the federal poverty level. So the federal poverty level for one person in the United States is $12,000. If you have a family of one, that federal poverty level is about $12,000. Means that you don't have enough to pay for a lot. So now, when the Affordable Care Act came into being, they decided that they were going to use 138% of the federal poverty level to determine whether or not you get Medicaid or you get the Affordable Care Act. Now, Medicaid is a program that's run by the states, but 90% of the money comes from the feds. So if you make $17,620 today in 2020 and below in a household of one, you qualify for Medicaid, which is a state program funded by the feds, run by the states, but it's free. If you have a family,
wait a minute.
yes,
Give me those numbers again. If you make 17,000, give me
17,000,
that again.
yeah. So if you have a household of one and you make 17,620 and below, you would qualify for Medicaid, which means that the coverage would be free.
Right.
But Medicaid is a state program funded by the feds. So what happens is that when you have to go to the doctor or the hospital, you would go to a doctor or a hospital who accepts Medicaid, and that treatment will be done in your state where they accept Medicaid.
Okay.
So what happens if you fall off the wagon, there's a program for you. There are a lot of industries where people work hard every day, you know. Unfortunately, like the food industry, the restaurant industry, a lot of times people don't make a lot of money. And what happens is that just like we have low income housing, Medicaid serves a low income health insurance for people. That's what it is.
I've never heard it put like that, but that makes sense.
Yeah. So what they do, if you have a household of two and the income is $23,797 and below, you get Medicaid. A household of three can earn $29,000. A household of four can earn $36,000. A household of five, $42,000, and a household of six, $48,000. So there's specific income ratchets that they look at, and how they know your income, because when I'm doing the enrollment process, I have to look at the tax return, your adjusted gross income, your tax return, and when we put that number into the system automatically bingos it with the IRS and says, this is truly the income, so therefore this person is truly eligible for Medicaid. And it's done instantaneously.
Okay, so Mr. Poole, just for to entertain my mind, and like I said, K-Rep, jump in at any time, but just to make sure that I got this right, because I know that there's somebody online now that needs to hear this. Right. Now, 17,620 or below, you qualify for Medicaid if you have one person in the household.
Right.
All the way up to 6 people in the household making 48,000 and some.
521, yeah.
Okay, less. Do you know how many people are working and making this particular money in this particular bracket and don't know that they qualify for Medicaid? That is the whole point and purpose of this segment. A lot of us, because we have not studied to show ourselves approved, we don't know that we're really wasting money when it is set up. There was something that you said in our personal conversation about people not knowing what it is that that's out there and that's available, and they wind up wasting a lot of money. They wind up wasting a lot of time. So I just want to make this clear, because people that are tuning in, there are government programs out there for you. And in Mr. Poole's words best, they are set up to help you. It is not a handout. It is something that is funded by the federal government, that if you fall in a particular bracket, you're covered. That's good stuff. I had to reiterate that, because you have a lot of people that don't have it and don't know this information.
Now, let me show you something else. There's some more complications behind this, how this works. Okay. So if an employer has less than 50 employees, they're not required to offer health insurance. Okay. Now, so what happens is that many times you may have that income, but many employers do offer health insurance. Okay. So what happens is that you'll take the health insurance because the health insurance gives you a broader ability to see more doctors. Because remember, the Medicaid program pays the doctors in the hospital the least amount of money possible.
Right.
Okay.
Right.
So what happens, employers, what they'll do is they may offer you health insurance, and what they'll do is in the group setting, the employer has to pay for at least 50% of your premium, okay, for them to have a group coverage. And instead of having the Medicaid program, you will have traditional health insurance, and you have a broader set of doctors that you can go to and hospitals that you can go to and states
Okay.
that you can go to. So what an
Okay.
employer does is they try to offset some of that and say, listen, what we're going to do, we're going to offer you health insurance. But there are many employers that have less than 50 employees who do not offer health insurance. So the people
Right.
that we're dealing with are the people that don't have health insurance on the job, because 70% of all health insurance is provided by your employer. And when people are rejecting the employer insurance, I'm like, you're shooting yourself in the foot. You know, they'll say, well, it's too expensive. Let me tell you how the Affordable Care Act comes in here. You know, if you were buying a house, we say that, and I'm a former mortgage banker, by the way. We say that if you're buying a house, generally the house payment should not exceed 25 to 28% of your
Correct.
monthly gross income,
Correct.
because then it's deemed to be affordable.
Correct.
Now, the way it works in healthcare, the Affordable Care Act says, hey, listen, if the annual premiums exceed 9.86% of your adjusted gross income, or another way of looking at of your income, then it's deemed not affordable.
Okay.
That's what they mean by affordable. So they're using the term, that's why they base it on federal poverty levels. So this is no longer a capricious and arbitrary decision. This is just based on your income. So what happens is that when people sit before me, I'm dealing with what is the actual income you actually have on a monthly, weekly, or annual basis. And I plug that into the computer systems, and the computer system will tell me right away, either you qualify for Medicaid or you qualify for the Affordable Care Act. It's not up to me. It doesn't have anything to do with it. I like you, I don't like you. It doesn't matter.
Okay.
All the computer does is it goes through the process. Now, what the public's confused is that they don't apply. You see, because what happens is that they'll talk to each other and they try to compare each other to each other, and then each of them
Yes.
have entirely different situations.
Yes.
You can have two people and they're best friends, they got two kids, but their situations are completely different,
Yes.
even though
Yes.
they live next door to each other. Because one person's tea is another man's poison. So what happens is that when I work with people, I have to sit and deal with their situation, not the girlfriend's situation or anybody else's situation. I have to deal with that situation. We have to validate it. There's a process that they match with there's a data match that happens with the Internal Revenue Service. All those things happen in the computer system. And once it matches, it says either, yes, we validated that this is truly your income. Based on this income that we have for you and the number of people that you have in your tax household that you claimed on your tax return, this is how we know what you really qualify for.
What you can
And based
afford.
and what you can afford. That's how the Affordable Care Act is pure mathematics. It has nothing to do with anybody's opinion.
That's good.
And it's done instantaneously. While you're sitting at the table, I'm getting your authorization right there as I'm filling it out.
Okay. So we talked about something, and I want to touch base on that. We're in a COVID year. I think that's really the right term for
Yes.
this year.
Yes.
This is COVID's year all day
Right.
long, right?
Right.
Okay, so we're in a COVID year, which unfortunately has cost a
Yes.
lot of people
Right.
their jobs where they were getting health,
Right.
health coverage. It has
Mhm.
cost them, entrepreneurs, good God
Right.
Almighty. We're still, trying to figure out this new rhythm.
Right.
So in this COVID world, you have someone that just lost their job
Mhm.
4 or 5 weeks ago,
Right.
and they have a deadline before that coverage runs out. A lot of
Yes.
times it's like runs to the end of the month, correct?
That's correct. That is
So,
correct. And
okay, so now
sometimes
you
and
have,
sometimes it ends the day that you leave the job.
You're right.
That
You're
happens
right.
too.
I remember when I was with Cox Communications, they gave me 2 months on mine. I
Mhm.
was like, come on, Jesus. So
Right,
I got everything done that I needed to get done. But
right,
then after it was over, I had no idea where to go, where to turn.
right.
So what is in the works or in the making, or what's currently right now available to people where this is their unique situation? I had a job, I had health coverage, my finances was balanced out because of my health coverage,
Right,
but now all of that's gone thanks to COVID. What
right,
do we do?
right. Okay. So there's two situations that you brought up. One is for self-employed people, and the other one's for
Hmm.
employed people that lose their job. I'm going to take the
Hmm.
first category, employed people who lose their job. Okay.
Okay. Okay.
So here's what happens. The first thing is that when you lose your job and you lose your health coverage, in the Affordable Care Act, that's known as a qualifying event.
I'm
You,
sorry. Wait a minute. I'm sorry. Hold on. Say that one more time.
when you lose your job and you lose health and coverage in the Affordable Care Act, that is known as a qualifying event,
Okay.
which means that you don't have to wait till November 1 to get coverage. Okay, you can apply immediately because what you have to do is that you have to get the letter from the employer that says this is your last day and this is the last day you're going to have insurance coverage.
Hmm.
So what happens is that you have 60 days to apply for coverage. If you procrastinate because you're depressed and all these other things, and you procrastinate, then they'll say, well, you got to wait to the next annual enrollment because you got to do it within that 60-day window of losing your coverage. So
So
let's say,
within that 60 days
all right, let's
of
say you lost
losing my
coverage.
coverage.
Yes, let's say you lost coverage on January 31st. All right,
Uh-huh.
that means
Uh-huh.
you have February to the end of March to apply for coverage.
Okay.
Okay, so what happens is that when you apply, we take the letter that you have from the employer that says this is the last day of coverage, and then what we
Okay.
do is we take your current income. If your current income is zero, you're going to get Medicaid. If your current income is higher than that, then you may get the Affordable Care Act. It's going to be one or the other.
But automatically qualified?
What happens is that it's going to qualify you pretty much automatically for one program or the other, unless you had a very high income. See, what
Wow.
happens is that when people are depressed, they freeze. A lot of us
That's
live
good.
quiet. A lot of people live what I call quiet lives of desperation. They don't want
Mm.
anybody to know that they've lost their job. They don't even want to discuss it, you know. And they don't want to tell them that they might be praying for a miracle and all stuff. But what happens is that they're not seeking so that you can find. So what happens is
That's
that
good.
they're talking to each other,
That's
but they're
good.
not talking to the professionals like us in the field
Come on.
that can tell you exactly what to do. Okay. So what happens is that so you've lost your job and you just lost it, say at the end of the month. So let's say if you lose it at today is October 20, no, October 30th.
30th, right?
All right. And let's say tomorrow's your last day. So we're going to try to apply for November 1 if we can, you know, because we're beyond the 15th of the month, you may have to get it December 1. Okay. Now, this is because of a qualifying event. Now, if you're just doing open enrollment, anybody that applies for open enrollment, not due to loss of job, that payment is going to be effective date is going to be January 1, 2021.
Okay.
But if you have a qualifying event, they try to get you covered the next effective first of the month as soon as possible. That's usually
Gotcha.
what we try to do. Because what you don't want to do, you don't want to have a long time where you have a gap in coverage.
Right. Right.
Anything could go wrong, accidents, all
Right.
kinds of things happen. So we
Right.
try to get people into the program as soon as possible. Now, so so what happens is that if you lose your job or anything like that, you know to apply for unemployment. And while you apply for unemployment, you apply for your health insurance too. You see, it's a
And
package.
nobody really thinks about that because they're focused more so on the I need this dollar, I need this
I need the
money to
money.
make the
Yeah,
bill,
but you
but
also
they
need
don't
your
think
health
about
insurance.
that part.
Yes, yes. Now let's take the self-employed people. Okay, the self-employed people. Can you hear me?
Yes.
Okay, the self-employed people. Here's the funny thing about self-employment. So in self-employment, it's not based on your gross income. It's based on your net income after expenses. So I have people that are making over $100,000 a year as a self-employed person, but when it gets down to what they really take home, they qualify for Medicaid. So
Whoa,
they end up getting free coverage
whoa,
or the Affordable Care Act. It's the net income. You see what
not the
happens?
growth.
Not the gross. It's the net income with self-employment in people. And a lot of people, they could be doing really great, and all of a sudden, I've had many professionals where they've got big cars and all this kind of stuff, and reality, by the time they got through with all their deductions, they were at the poverty level, and so therefore they ended up qualifying for Medicaid. And there's a whole balance. And what happens is that we look at the tax return, and we see that it validated that. We look at something called the adjusted gross income, line 8 of the 1040. What is the adjusted gross income? Okay, and this person's adjusted gross income was at the poverty level. So even though he was grossing over $100,000 a year, by the time he got through his office expenses and all the expenses and all the associations and malpractice and this and that, he had nothing left. So he actually qualified for Medicaid. Okay.
Mr. Poole, Mr. Poole, this is good. This
Mhm.
is good. I'm thinking about all of the uh, entrepreneur friends that I have, where
Yeah,
our focus point has been, health coverage. That's at the bottom, 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 because we put it in the category of
I can't
not the
afford it.
main. Well, not really the most important in this
Right,
basket right now.
right,
I don't even think we think about whether we can afford it or not. It's
right.
just I got other steps to do. I'm having to
Yeah.
figure this out. So you just, for me, you just opened my eyes up to something. Um,
Mhm.
People think, when you are running your own business and you are doing it, like you say, you're riding around in the fine cars, you got this, you got that. People fail to realize that there are costs that you
That's right.
incur
That's
to
right.
run a business. There's
That's right.
costs that we incur right now to be able to do what it is that we're doing now. Just
Right.
because it's on Facebook does not mean that there's not a dime connected to it.
That's
And
correct.
so understanding that, basically what you just said to our entrepreneurs, to those people that are refusing to let COVID defeat us this year, and we're just
Mhm.
going to run on, you're basically saying, don't count this part out.
Right.
Because one, no man knows the day nor the hour. We don't know whether we're gonna get sick. We don't, whether we're gonna need it. And then to know that we can offset with that income that we would have to pull out of a bank account, or that income where we would have to take out of a loan, just to have somebody to have surgery. You're basically saying right now, just because your gross says $100,000
Right.
doesn't mean that your net is the same,
That's
and
right.
you are
They're two different
based
numbers.
off of your net. You are qualifiable off of your net. That
Right.
is good.
Right.
That is
Right.
some good information.
Now, here's the other thing. So, what happens with the net? So, this person was just by themselves, but what happens is that we take we take the adjusted gross income. If you're married, we take the net from the husband and wife, and the
Okay.
number of people and kids. So, I just want to give you that we have the ability to look at the entire picture. Okay, so the husband's business might be netting very little, but if the wife is still working, you see, we add that up. So we take the
Okay.
total household income to
Right.
determine where you stand. Because it could be that even though that the husband might be netting poverty level, if the wife is still working, okay, either you get on your wife's program, because anytime you lose coverage, okay, you have 60 days to get on your spouse's coverage. That's another thing people don't realize. You see, because
Okay.
that creates an open enrollment at the employer level. Because what happens is that if you lose coverage on the job and your spouse is still working and they have health insurance, the first thing you do is try to get on their program. But what happens is that consumers will say, but that price is too high, that price is too high. And maybe it is. But the reality is that when people say things are too high, they're basing on the fact that maybe they won't have enough money to pay their bills, you know? But the thing
Hmm.
about it is that when you say too high, we always say compared to what? You see, when you're
Hmm.
out here and you don't have health insurance, you are facing unlimited liability. Unlimited
That's good.
liability. The reason why you pay a premium is you're transferring that risk to the insurance company so that you don't incur the unlimited liability.
That's
That's a,
good.
that's what you're doing. You're transferring risk, because this is what we call an insurable risk, to the insurance industry and let them take on the heavy lifting. That's why you buy the insurance. You know, if you buy a house, if you finance a house and you say, "Oh, I'm a good person. I never start fires," the bank's going to look at you like you have two heads. They said, "No way. Are we going to invest in $100,000 or $500,000 house and not have any and not have any fire insurance
Uh-huh.
on the house?"
Right.
Okay? So if we protect our houses, okay, like that, and we protect our incomes, then why not protect our health? Our health is our wealth. And if you can't ever get back on your feet because now you have unlimited liability with the hospitals and the doctors, this is what causes the bankruptcies. 60% of bankruptcies is due to medical bills. You see, here's another thing to keep in mind. When you buy health insurance, like, you have these big box stores like, let's say, Costco. Everyone's familiar with a Costco. If you become a member, you get to get these big discounts, right? Okay, so here's the deal. When you buy health insurance, the health insurance companies have already pre-negotiated the best possible rates with the hospitals and the doctors. So if you walk into that same doctor and hospital by yourself and say, "Oh, I want to pay for this on my own," ha ha ha, that doesn't impress anybody. You see, because what the insurance company is doing is that they are volume purchasing the services. So they can get as much as a 75% discount off those rates. 75%. You walk in by yourself, you pay the full price. But when you're part of an insurance company's healthcare program, you're getting a volume discount. Now, why would the hospitals and doctors give such a big discount? Because let's say you're a doctor and you're sitting in your office and you have no patients. And I walk in from a major insurance company and say, "Hey, doctor, what's the matter?" You say, "Mr. Poole, I don't have any patients." I said, "Doc, that's not a problem. I'm insurance company A. I can get you lots of patients." And the doctor says, "Well, how are you going to do that?" Well, as an insurer, we have something called open season. And every time we sell a new group and every time we sell open season, the first thing the employees do is they look to see which doctors are in their zip code or in their area. So it happens that when they do that, we can pretty much guarantee we can fill your office with patients. So if we fill your office
Mm.
with patients, we want to get the best price from you. Not only that, but if you want to get $3,000 to take out someone's appendix, and the going rate's $1,200, we're going to pay you that $1,200, but you cannot come back to the patient for the other $1,800. So what insurance does is that not only does it get a discount, but it also says they protect you against balanced billing if the doctor or hospital is participating.
That's why I love the phrase and the reference that your health is your wealth.
Yeah.
Because when you understand how to move when it comes down to health coverage or keeping yourself covered to make sure that you stay healthy,
Right.
it saves you more money in the long run.
Oh yeah.
And so I
long
know,
run.
yeah, we were K-Rev, we were talking on yesterday evening. He had some, if you don't mind me sharing, something fell off of a truck and had some severe damage to his car. So I mean severe, I mean severe. So
Right.
if he was not covered, if he had not taken the time to, you know what I'm saying,
Right.
pay that
Collision.
money, some people may look at it as a sacrifice, and sometimes you have to sacrifice for the greater good. So
Right.
if he would not have sacrificed paying that insurance every month, then he would just have a broke, busted car and nowhere to
That's
go, and
Yeah.
still trying to figure it out and still having to try to borrow money. So it just seemed like a perfect scenario, Carrie, to share in this right now when it comes down to having health coverage.
Right.
So I want you to, first of
Shanta,
all,
one other thing, Shanta, I want to mention. Here's another piece of this. Suppose we have you on the Affordable Care Act, and then you lose more money. Your income goes down even further.
okay,
All you have to do is report that decrease in income, and you might end up getting Medicaid. It might be free. See, this is not a one-time type of thing. This is dynamic. So what the system is designed to do, it says that if your income goes up or down, you got to tell us within 30 days, because we're here to help you when you're down. But when you get back up, we kick you out. You see?
You know what's so funny? We have the mindset, the mentality. I ain't gonna have them folks all in my business time. It's gonna cost me something different. Hey, Rep, didn't you say that yesterday? It's gonna if they're gonna cost me. They're gonna cost me. No, what's gonna cost is if we don't move
That's right.
when we're supposed to move.
Yes, yes.
Oh my goodness.
And see, here's another about your business. Okay, here's something else. I give you guys a news flash. They already know about your business. It's no secret. If you fill out any government paperwork, they got you. They know who you are. They already have the information.
Gotcha.
The only thing you're doing when you call them and say, "Hey, listen, I know last year I made 100 grand, but this year I'm making 50." Okay, so if you don't let them know, if you don't let us know that something has changed, the system is designed. Remember, affordability. The Affordable Care Act is based on affordability, and if your income goes up or down, you should be letting them know. Okay, because if you fail to let them know, let's say, for example, you get back on your feet during the year and you don't say anything to them. What happens is that they're going to come back to you when you file your taxes the next year and say, "Hey, you told us you're making 50,000 and you filed your taxes and you showed 100,000. So bingo, all that money that we paid for you, we want some of that money back."
They're back.
So they claw back to you and say, "Wait a minute, you didn't tell us. You're supposed to tell us within 30 days of your good fortune." But what happens is people, what they do is they don't want to say anything.
I ain't gonna tell them about my business. They don't need to know that.
They don't need to know my business. But what it is that they do need to know your business, because what happens, they're giving you the help based on your integrity and based on your need and your finances. So they help you when you're down, but as you get back on your feet, then they start taking away the credits and things and say, "Look, now you can afford more." You see,
Right.
so it's a sliding scale, and people forget they think they can just do it once a year. But if your circumstance changes, I have lots of clients. They call me up, "Hey, now I'm making more money." I say, you better tell them, because if you fail to tell them, you're not going to like your tax bill at the end of the year.
Okay, so we have a household, excuse me, that single individual, 3 kids. So that's 4 people in the household. Gross income, $150,000 a year.
Right.
As an employee.
Right. As an employee, first of all, the income is too high for the Affordable Care Act.
That's what I was trying to get to. A lot of people, I like the way you said it in the earlier in the interview, where just because we're neighbors, we got the same amount of kids, doesn't mean our situation is the same. You had a lot of people that were had a negative opinion of the Affordable Care Act. Because my premium, I applied, my premium was too high, and I used to tell people it ain't for you. It's not for you. And a lot of people don't understand that. If you are in a position to be able to afford your health coverage, this government program is not for you. This is created for those that are in a position that cannot. But everybody was running because everybody, we in the hookup generation, and I wanted, that discount and, all of that good stuff. So at the end of the day, people need to know when to and when not to.
Yes. So what happens is this. Let me give you the situation with the W-2 employee that's making $150,000 a year. First of all, they don't have the same ability to deduct expenses like a self-employed person does. You see, because they're W-2. Now, if they're making $150,000 on the job, chances are that employer is already paying for at least 50% of their coverage to begin with.
Okay.
But what happens is that they'll say it's highway robbery. Let me tell you what happens with the expenses. As we get older, insurance gets a lot more expensive. In fact, if you're in your 20s versus in your 50s, the person in their 50s, the premium could be as much as 3 times higher than the person in their 20s.
Right.
It's just a fact of life. You get older, you're going to pay more.
You're considered more of a risk.
You're higher risk. The more we call it the morbidity factor. What is the probability of you getting sick, diabetes, overweight, da 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 da? We have all of those things. Those are chronic diseases that the insurer has to pay on a monthly basis for the cholesterol, for the insulin, for all these different things, the constant this, that, and the other, to keep you from going off the deep end and having a really serious problem, and mainly like a heart attack, for example. So we just have to face the fact that as we get older, you're going to pay more. Okay, there is no free lunch in America, as they say. So excuse me. So what I have to do when I plan, I'm always planning as I get older. What am I going to do for revenue? What am I going to do? A lot of people say, "Well, I'm just going to retire when I get to be 65." The problem is that inflation is still running 3.5% a year. So 10 years from now, your money is only worth 65 cents on the dollar than it was 10 years ago when you retired. This is why even if you retire, you have to have multiple streams of income going all the time, simply because you can't rely on the fact that the job says, "Oh, you retire." Too many people buy into that, and they think they're supposed to sit on a rocking chair for the rest of their lives. That is not the way. We are in a capitalist society, and we have to keep finding ways to earn a living. So I have multiple streams of income. It's not based on me by the sweat of my brow. It's based on the transactions that I do. Okay. Now,
I had years ago when I was touring, I was blessed to do some work and be out on the road with the Commodores. And one
right.
of the things that Walter Clyde Orange said to me was, little girl, and I did not take it offensive. Little girl,
Right.
let me tell you something. Never rely on one thing.
Right.
He said, yeah, people know me as Mr. Brickhouse.
Right.
He said, but let me tell you something. It ain't Mr. Brickhouse that's taking and paying all my bills,
That's right.
And I took that moment, even though I was out there, dealing with one thing,
Yeah.
I took that moment to receive that. And I promise before then, I didn't entertain the thought of multiple streams of income because there was a favorite tagline. You got yourself stretched too thin. How many? I know y'all done heard that. You got too many eyes in the fire. You're trying to do too many things at one time. So hearing that, it programmed my mental to where, I only have the capacity to do one thing.
Right.
I can't do anything more than that. And a lot of people, that is good. That was good, God. And a lot of people fail to realize is because we are programmed that way. We are limiting ourselves to the abundance that life has, waiting on us. And so from that moment on, it was like, okay, well, let me add this one. And then let me just balance out my day to where I can get this one covered. Okay, well, let me add this one and let me balance out my day, which I totally believe has led me to the seat that I sit in right now. Because if I would have allowed myself to stay boxed in mentally, then I would not know what I know about the Affordable Care Act. I would not know what I need to know to be able to help my fellow brother man. And I'm gonna put a tag in right here. K. Ram, you are rather quiet. Are you listening and learning? He hasn't said anything. But I want to take this moment to
it all in.
I say what now?
He's just soaking it all in.
That's what it looks like.
I see his brain. I see his brain up there just twisting.
We have. I'm gonna give you the floor. Give me 1 second. I want to take this moment to let people know we have about 15 minutes left. It is not too late to tag, share, and invite because I know that it's somebody in your family, somebody on your job, one of your friends needs this information. And Mr. Poole, before Carrie takes the stand here, tell people how they can get in touch with you.
Okay, so they can reach us at our office number at 301-925-2050. That's 301-925-2050. And then also they can reach us on our website at www.aligned, ALIGNED, benefits, BENEFITS, group, GROUP.com. And there's a contact us section there, and it says contact us, and it says info. You fill that out, and that'll get to me as well.
Okay. All right. Carrie, you got it.
I'm not going to be that long. Good morning, Mr. Poole. How you doing?
Hey, good morning, Brother Rivers. It was good to see you again, my friend.
Man, it's always a pleasure to see you. I've had the fortunate pleasure to speak to you before. He was on the nighttime show. We had a great time, and I am definitely
We did.
pleased to be here. Not going to be too long. I got another interview to get ready for. But I've heard so many statistics. A lot of people have heard from you concerning discounts and concerning net and gross pay. And what are some of the price points that you've seen in your career?
Okay.
Concerning much of the discounts. Like, what are some of the prices that you've seen go from here to here? Could you give me some of those examples so we can kind of see the significance of your of
Okay,
the
great.
Affordable Care Act?
Excellent question. Well, I'm going to start with the premium. With the Affordable Care Act, I've had people had premiums at $2,400 a month. And by the time we looked at all the options, they were paying $13 a month.
Come on.
That's what I wanted to hear. Okay.
Yeah, I
Okay.
mean, the affordable. I did a quote the other day, and the premium, the lowest premium I could get for them was $1 a month,
Wow.
and the kids were free because the kids qualify for Medicaid. You see,
Right.
the
That's
thing
the
about it
Okay,
is
wait,
that,
wait, wait. Wait,
huh?
wait, wait. Because I was about to ask that.
Yeah,
The parent got the
the Affordable
coverage,
Care Act,
the
right?
Affordable Care Act,
But the
$1
kids
a
got,
month.
but the kids
And
got Medicaid.
now, are the kids also covered under the Affordable Care Act?
What happens is that the Affordable Care Act is like think of it like a funnel. It's like a qualifying funnel. And what
Okay,
it
Mhm.
does is that it looks at this and says, okay, the kids can take this route and the parents can take this route.
okay,
The beautiful thing about the Affordable Care Act, it automatically qualifies you for one or the other. Because what
okay.
happens that now the states actually do the final qualification on the Medicaid program, but what happens when you start the application, that same application goes both to the Affordable Care Act and the Medicaid program. It hits both at the same time. That's you fill out one application, and what happens once you fill out that application becomes your funnel for you to report your income up or down, and based on what your income is or isn't, it automatically kicks you into one program versus the other program. It either adds tax credits or it takes away tax credits.
And if
That's
you
why.
are approved for
Mhm.
Affordable Care Act and you have minor children, they're
Right.
automatically approved for Medicaid.
Now what happens, it'll be automatically approved if they qualify for it from the financial picture.
Okay, okay,
That's
okay,
how it works.
okay.
You see, so what
I,
happens, so the point I'm making about all this is that people are forming opinions, people are tweeting, but they're not reading. And
that's
even
good.
even if and here's the other problem that we have in our society. When the Affordable Care Act passed, President Obama loved him to death. He thought, in his at his age group, that everybody's going to be able to go online and get their own program. But I knew that wasn't going to happen because people that were in their 70s and 80s who never used a computer before, like my mother, they simply come to me and say, "Can you fill this out for me, please?" And
Right.
as a dutiful son or daughter, I'm going to go ahead and do it for them. I'm going to go online and fix it all up for them. That was not the reality. Not only that, here's another big misnomer. This is why people are so frustrated. I have doctors, I have lawyers, I have engineers. They went online, they tried to fill it out by themselves without the benefit of training. And they screwed the whole thing up. They answered the
Mm,
questions in the wrong way. They did everything completely wrong. Okay. And the system is very unforgiving because once you choose a plan and you get beyond a certain date, you're going to keep it for the rest of the year, right?
right, right.
So what happens is that so here's the deal. Here's why it's so hard. The reason why it's so hard because most people are not trained in the insurance business. So here's what happens. What happens to me as an authorized agent. First of all, I had to be trained. I had to take the Medicare training program, get authorized by them, because this whole thing is run by the Centers for Medicare and Medicaid Services, which is part of the Department of Health and Human Services. So I had to get trained as a broker to become authorized as a broker. Then
Okay.
they did a validation testing on who I was. They did identity proofing of who I was to make sure I was who I say I was. Okay. Then they validated my computer system. Then after I got validated and trained and authorized by the Centers for Medicare and Medicaid Services, Then I had to get trained by the states. Then I had to get validated by the states. And, and after I got done with all the training and all the computer glitches and things that they had in the system, then I had to get trained by the insurance carriers because they have a lot of technical terminology. One thing means one thing, one means another thing. So it varies from company to company. So if I had to go through all of that training and all of that validation, the public doesn't even have a chance to compete for
That's
what we
good.
know.
That's
Okay.
good. That's
Like for
good.
example, I get notices from the states about their computer glitches. I know which computer systems are working. So let's say, for example, someone I know people say, "Oh, I love my Apple." Well, they didn't develop the thing around Apple. They developed around IBM PCs.
That's
So you go in there with your iPad thinking that you're going to be able to get this thing and it ain't working because you don't know they designed it around the iPad. They
that's
designed it
good.
around an IBM PC. It wasn't designed around an Android phone. It just wasn't done that way because you need the real estate on a laptop or on a desktop PC to see everything. And they
That's
weren't
right.
going to go through all this development costs because it's very expensive to go all these development costs straight. And I know that as an IT person. So what happens is that you dialing in and you're thinking, honestly, I'm the smartest person. I have 2 PhDs. Da, 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 da. None of that matters. What matters is the training and the latest thing. I know the latest glitches that are going on with the system. There are workarounds I got to do to get around the system because the states tell us, look, we got a problem with this. So when you run into this problem, just do this. You as the consumer, you don't know that. That's
Hmm.
why that we are authorized brokers in the system because we have to go to their meetings and get with all their latest computer glitches and things aside from the carrier issues, aside from the carrier training. There's just no way you can do it, no matter how smart you are, without you going through extensive training like we go through.
I like the way you broke that down because come on now, let's keep it real.
Mhm,
Growing up, I know for me, the
mhm.
insurance man, we always ran to the back of the house when we saw his car pull up in the front of the house.
Yeah, that's
Because
right.
like,
That's a debit agent. Yep.
yeah,
Coming to cut the
insurance
premium.
man, hey, he coming to get that money. And that was the
That's right.
whole focus. That was
Yeah,
the
take the
focus.
dog on them. Yep.
Right. You know what I'm saying? You better be quiet. Shut that dog up. All this stuff. Okay. All because you did not want to pay or you
Yeah.
didn't have the money,
Oh, you have the
to
money.
pay. But when I'm hearing you, the way you're breaking this down, I tell people all the time, you know what you know, and that you do know, we're supposed to share that. We're supposed to give that to make people better at what it is that they're doing. So you're basically saying, hey, world, common people that don't do this for a living, stop defeating yourself.
That's
We're
right.
out here waiting to just answer your questions. And that's just like, and for those of you that are online now, listen, this is that time. We got 5 minutes left. This was that entire hour to get those questions answered. And without even people putting their questions in the comments right now, you've answered a lot of questions here. And
Oh,
so,
before you go on, I need to make one other mention. It's very
okay.
important. One of the things the Affordable Care Act did was they made it revenue neutral in terms of talking to a broker. A lot of people will say, "Oh, I don't want to talk to that broker. That means I'm going to pay more." No, 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 no. The system is set up. The broker fees are built into the premiums already. So they made it revenue neutral. So if you don't talk to people like me who know what we're doing, because you think I'm going direct to the company, I'm going to save me some money. I don't have to talk to that broker.
Right.
You see, that's another misnomer. We are already getting paid by the carrier. You don't pay us a dime.
Wait a minute, say that again. So you running to the back of your house is not costing me anything. I've already gotten my money. That is
Exactly.
good.
You
That's
see,
good.
so what happens is that we only get paid on the people that we enroll. Number one. Now, a third of the people that we help get Medicaid, and we don't get paid a dime for that. Okay,
Mm,
it's just a public service. And we do it because it is the right thing to do. It is part of my ministry to help people. That is the override driving force. I don't get paid when you get on Medicaid. I don't know what you're going to qualify for when I talk to you. When we work as brokers, we're working completely at risk. We work completely at risk. So what happens that if you qualify for Medicaid, I just helped you, you get it, I don't get paid. If you get a product on the Affordable Care Act, then the insurance companies will pay me. So you don't pay me a dime. So I work completely on faith in the system, and not just me, but all the brokers who are authorized. We all operate the same way. We all, and the other thing is that there's no broker that can get a better rate than another broker. We all drink from the same trough. It's the same rate for everybody.
That's good.
So number one, it doesn't cost you any additional money to talk to us. And number two, we all have the same rates. We have access to the same rates. There is no broker that has any different rate than another broker because they have an inside
it's all being put into the same system.
It's in the same system. That's right. We're all in the same system. You see? So there's no incentive not to talk to those of us who are skilled and trained in the subject matter. There is no additional price that you pay. That's why we are authorized brokers in the system, because they know that we've been trained on the subject matter and we most likely know how to guide the customer through the process. That's why we exist.
Poole, as we get ready to close here, one of the last things I want to touch on. This is an election year. We have just a few days before the world chooses our new president of the United States for this, term around. I myself personally feel that in itself, because of the unstable of the economy right now, as a little phrase that says, you better get it while the getting is good.
Yes.
And so, because with open enrollment right now, with people such as yourself right now that are positioned to answer those questions, aid people in getting the health coverage that they need before this is shut down and we're not able to. I want you to touch base on the level of importance it is with the state of the economy right now.
Right.
To have this at the top of your list where, opinions and other people talking that not knowing has made us put it at the bottom of the list. I just do believe personally that we're in a space right now where it needs to be at the top of the list.
Yes.
Could you,
yes.
Please touch on that as we close.
So here's the thing. The Affordable Care Act is critical for all of us. I mean, for every person, pretty much, especially with COVID. In the state of Maryland, for example, they governor declared that they changed open enrollment from just November 1. They made it available for all of 2020. So in Maryland, we were able to enroll all the entire year just because of the crisis. Okay.
Wow, that's good.
Now, here's something else to know. You want to keep the Affordable Care Act, no matter what anybody says, because it's both public and private. It's designed properly. Now, if you live in a rural area, you may not like it because you just don't have enough people in the community because insurance is about pooling money to cover those of us who are sick. Right. So what happens, that's why the federal government has to add some additional funding to cover rural areas. But if you live in a large metropolitan area, the Affordable Care Act is your best bet as far as where you don't have coverage on the job, and it's not for everybody. It's not for every situation. But when the shoe fits, you got to wear it. Now, as far as elections are concerned, let me just say this. They're talking about doing away with the Affordable Care Act.
Yeah.
Now, here's the thing. Everything that I've read in the legislature says that even if they strike down the Affordable Care Act, it's going to take 3 or 4 years to do it because they don't have a replacement.
Gotcha.
They have nothing else to replace it. So if they want to continue with no pre-existing conditions and all these other things, the Affordable Care Act is a huge computer infrastructure that's set up in all these states and the federal government level. So it's going to take at least 3 to 4 years. And I think what's going to happen is that the Affordable Care Act will still be around. They may call it something different because they may tweak it differently, but it's still going to be around because now the public has gotten used and they've tasted it. One thing about government programs, once you give it to the public, it's very difficult to take it away.
Yeah. Okay.
So I'm not as worried about it as most people may be, because I know, like I said, I'm on the inside track. I go to a lot of the legislative meetings. I get all this legislative stuff emailed to me every day. So I'm inundated with this stuff. And that's what they're all saying. They're saying, look, even if they say they want to take it away, how did they do it? They may say, like, for example, they say, well, we got rid of the individual mandate. That was the penalty if you didn't enroll as an individual. So what they did was they just lowered the tax to zero. The mandate is still there technically, but they just
Okay.
took the tax rate down to zero. Okay,
Gotcha.
and
Gotcha.
but the thing about it is that as a society, can emphasize the importance of voting and making sure that you understand what it is that you have. As I mentioned before, everybody's tweeting, but very few people are reading. The media is not covering the Affordable Care Act properly. They're not educating people. That's why I'm on your show. That people need to know from the professionals how the system actually works and why it's important for you and your family. Just know that you have a safety net. You don't have to panic. You don't have to scream. You have to apply.
Mm,
And you got to do it in a timely manner. If I get too depressed and I wait longer than 2 months, then it's on me.
right.
So the moment you get hit, this is the real lesson I want to share with everyone this morning. The moment you get hit, don't spend a lot of time being depressed about it. Take action. Call the right people and get help immediately. That way you can face your challenges much easier after you lost a $150,000 a year job.
Hmm.
You pick up the phone and call those of us because you need your health insurance. Because if you get sick and have an unlimited liability and can't pay your bills, then they come after you. And yeah, so those are some of the things I just want to share this morning.
Thank you for being here. I'm looking forward to doing this every fabulous Friday here at OPNS because you have dropped a mountain of knowledge and things that I didn't even think about. And knowing what I do know about open enrollment, you really enlightened me. And I even from the qualifying bracket of the income, where people have convinced themselves or their neighbor told them that they made too much money, but there's a certain bracket to where you actually can apply, and be approved. This was awesome. Thank you so much, Mr. Poole.
Thank you.
And
Thank you. Okay, we have both.
I'm looking forward to this. Yes, I'm gonna tell you, 8:45 is early for me. I'm up late at night, but this is something worth me getting up for. Thank you so
Absolutely.
very much for sharing with my OPNS platform. Carrie, any words before we close?
Um, again, Mr. Poole, thank you so much for being available. You have a wealth of knowledge, and as I say to a lot of people, thank you for your experiences. Thank you for where you are right now, because if it wasn't for your experiences in life, we wouldn't have this opportunity to hear what you have to say. So I look forward to listening to more of what you have, and it's just an absolute pleasure and treasure to have you as a friend, an acquaintance, and someone that can consult with people like myself. Thank you so much
Well,
for that.
I thank both of you, and I'll share one last point about all this. One of the reasons why I feel passionate about this is because right now I'm at a point in my life where I've studied so much. I have a double master's degree. I have certifications in cybersecurity and all kinds of fields. But here's my deepest concern. If I do not share this information with my younger generation, when I reach the winter of my life, when I can no longer speak for myself, if I haven't done a good enough job sharing it with my younger generation folks so that they really get it, when I reach the winter of my life and I can no longer speak for myself, I'm hoping and praying that you will be able to speak for me.
That is a great way to end this segment. You hear his heart. And I just do believe that when we love God's people for real, that our work is not in vain. Ah, thank you guys for tuning in right here, the new OPNS. And yes, we are still new. OPNS 97.1. Thank you, Mr. Poole. Thank you,
And
K
thank you.
Rev.
Thank you.
Here
Thank you both.
we grow. Guys, share this video, tag, invite, share. Somebody needs what you allowed yourself to position yourself to receive today. Somebody is needing this wealth of knowledge. So go be great. Go take and do your part in blessing somebody to their next best in everything that they choose to do. Open enrollment starts Sunday, but ready to be signed up as of Monday morning. We're going to share Mr. Poole's information with you. And definitely, he said, you're tweeting, but you're not what?
Reading.
Here we grow, y'all. Shanta Moore, OPNS Inspiration Zone, 97.1 FM. Have a blessed one.